Very good evening, friends. Meeting again in the session of Materia Medica. Yesterday, we have learned one more remedy from B series, that is the borax. And today, we're going to start with new one, a Bovista, a puffball, a fungus. It's a remedy generally not so commonly used by people, but having a lot of importance, specifically in female complaints. It is a wonderful remedy to be utilized. I will share one case which was there in May 2015. A 30 years female, she was brought 35 years female, she was brought to me with a diagnosed case of para-ovarian cysts along with metrorrhagia. So that was the diagnosis, and she was asked to go for operation, and she refused, and she was little bit frightened because of it, what to do, and she was having a metrorrhagia, irregular menses. Second important thing which she has mentioned, that she had very dark clotted blood. It looks like a lachesis, because there was one important symptom which was there along with that, that there is intolerance of tight clothing around the waist. She has specifically mentioned. So I was thinking about lachesis in that direction, but I was writing down all the details, and she explained, "Doctor, I want to say something." I said, "What?" She said, "I used to get in between the periods, sometimes there is spotting or sometimes traces of period in between the menses. And this happens many times. Second important thing, whenever I used to get the menses, it is always followed by the leukorrhea, white discharge, and that white discharge is of a greenish nature, it is stringy nature, it is very causing lot of irritation to my pelvic area, vaginal area." That was another thing which she has mentioned. Then when I was observing her, there were many acnes on her face. It was case was in May 2015. So I asked her, your age is 35 and still you get the acne. She said, yes, doctor, but actually I never came for that. But this is my big problem. I'm getting treated from the skin specialist, but it is not getting settled. And this is my problem. Every summer I used to suffer from these acne. So that was another important thing which she has mentioned. Then there was a one important thing which ultimately came out. I asked that, do you suffer from any problem before or during menses, or anything specific related with menses? And she said, "Doctor, whenever I used to get the menses, I used to get a diarrhea every time. So every time before getting menses, I used to know that now I will going to get menses. Before one day, I used to start getting diarrhea, and during menses also it used to happen. So it was mixed picture, something looking like lachesis, something looking like ammonium carb, diarrhea before and menses. She also explained that whenever this dark clots of menses passes, there is tremendous bearing down sensation. Something is going passing from the vagina. That sensation is there. It looks like a sepia again. But one characteristic modality which she has explained, doctor, one thing I want to tell you, whole day I'm free, and my menses I used to get whenever I lie down at night. And that was the big differentiating factor from the lachesis, from the sepia, from the ammonium carb. And this is a big thing that which is characteristic of very few remedies. So I thought of Bovista, and Bovista has that typical features, the concomitant, which is very characteristic enough, that acne is aggravated during summer season is characteristic of this Bovista. Second important, menses only aggravated and flows at night whenever lying down. That is another characteristic. And then I have gone through the Bovista. And Bovista is the combination of all those three, four things. But it is subacute acting remedy. It is not so acute, it is not too chronic. It is subacutely acting. Its action is around 7 to 14 days action is there of Bovista. So I thought about the Bovista, and there was all those features which are mentioned over there. So I started her on Bovista 30 in repeated doses. Bovista you can repeat for at least for a week. You can give safely. There is no need just to give a one dose. No, it requires little bit repetition because the pathology is there. Generally, it is psychotic pathology, var ovarian cysts, ovarian cyst. These are pathologies which are psychotic enough. So I have given Bovista 30 to her and asked her to continue it and meet me after 15 days. After 15 days, when she came, she was quite happy. No, nothing in between. The last menses, she had a problem. Now she was absolutely normal. I have given her placebo, asked her to meet whenever she get the next menses. And luckily enough, that next menses, when she came to me on the third day, and she said, Doctor, this time flow is good, not too much, not only at night now. I am getting regular menses, like a menses, and their first important thing, first time I have never got a diarrhea. It means that remedy has acted. Her basic problem was that. So I have continued her again with the Bovista 200 letter and one or two doses of 1 m letter, and she recovered completely. So it is a very important remedy for female complaints. And Alan has mentioned very specific actions of Bovista. We'll learn the Bovista. Bovista has skin affections also. It is a very good remedy for the acnes, pustular acne, suppurative acne, specifically during the summer season. This is a wonderful remedy. So let us open your the Allen's keynotes. Bovista, it is a pub ball. I want to show you just the how it looks like. This is just one. I will share how it looks like. This is the picture of pub ball. This is Bovista. Are you able to see? This is one picture and another one you can see these are the typical pictures of pub ball. So this is fungus, very typical, having action. So let us see what he talks about him. Persons who suffer from tetary eruptions. What happens? We used to read the sentences, but we you never understands what it means. What is tetary eruptions? Tetary eruptions means the vesicular type of eruption generally. They are reddish in appearance with vesicular. So generally, wherever there is a vesicles happens to be there in scabies, vesicles happens to be there in acnes, vesicles happens to be there in herpes zoster, herpes simplex, sometimes you can get the vesicular eruption. So this is a wonderful remedy in tetary eruptions, dry or moist, both types of varieties, both varieties. Dry eruptions might be dry, might be moist, but generally those eruptions are moist, exuding the mucoid fluid. Adapted to old maids with palpitation. See, very important feature again. Adapted to old maids. Old maids is very important word. One should not forget those things. These are the hints which you have to catch. These are the people, old maids who used to suffer from palpitation. That is very typical with this. Sir, we'll call you after 15 minutes. So, old maids with palpitation. One remedy you should not forget is Calcarea ars. Calcarea ars, slightest emotional excitement causes and palpitation, generally on old peoples, that you can get. So this is also one remedy which you can think of in specifically old maids where there is a palpitation. Stammering children, very close to the stramonium, but every remedy has its own importance. Stramonium, it is the children used to suffer with stammering. They gets obstructed at the first word. If you ask what is your name, my name is that this is how they start. That is stammering of stramonium. They always and their face becomes absolutely disturbed. Look, disturbed because of that uttering of not able to uttering proper word, and that is the stramonium. Here it is general stammering children. Yes, one important remedy. Then discharge from the nose and all mucous membranes, very tough, stringy, tenacious. Even leucorrhea is tough, stingy, tenacious. So this is a remedy very close to the Kali bichromicum, where all discharges are tough, stringy, tenacious. But Kali bichromicum is syphilitic remedy. This remedy is more of a psychotic nature. So that is the thing which you have to catch where the differences are there. Second important thing, they are more ropey and mucoid in Kali bichromicum. In this Bovista, they are of greenish character. Greenish character is again a character of psychotic miasm. So you can understand remedy with the help of miasm, then it becomes simple. Kali bichromicum, it is purely syphilitic remedy. Acute syphilitic remedy is Kali bichromicum. Usually deep impressions on fingers from using blunt instruments, scissors, knives, and this is common thing. Those who used to use the utilizes those weapons again and again, they used to have very typical impressions on the on their fingers. If it is making a big impression, think of Bovista. That is one important remedy which has been mentioned, but I have not yet utilized for that specific thing. Intolerance of tight clothing around the waist, calcarea, lachesis, sulfur. Yes, it is very characteristic feature of lachesis. Lachesis intolerance of tight clothing around the neck, around the chest, around the waist. Everywhere it is present in lachesis. And lachesis is also having dark clotted blood. In the menses, dark clotted blood. Lachesis is also hemorrhagic tendency. So it looks very close. But this remedy, the weakness is more marked, the numbness of the extremities, weariness is very marked in case of Bovista. Sweat in axilla smells like onion. That is the characteristic of the remedy. Many patients they complain that I'm having severe sweating in the axilla. And then if you ask how it smells, if they specifically mentions about the onion, the Bovista is the remedy. If there is a sweating look, smelling like sweetish, it is thuja. Thuja has a sweetish smell. Generally, around the genitals, it is very marked with the thuja. Hemorrhage after extraction of teeth from the wounds, epistaxis. So, this is a hemorrhagic remedy. After extraction of teeth, the bleeding is there. Hemamelis is one of the important remedy which you can think immediately. The first remedy to be utilized is arnica and hemamelis. Bovista is another one. Hemorrhage from wounds, hemorrhage from nodes, that is epistaxis. Great weakness in joints and weariness of hands and feet. The weakness is more marked in the specifically in hands and feet. That is very typical of this remedy. Then one feature which goes very close to the apis, but this remedy is not hot as the apis is. Awkwardness. Awkwardness inclined to drop the things from hands, very close to apis. But apis, the stinging pain is the characteristic. Apis is very hot remedy. Apis is thirstless remedy. So these are very typical things of apis which are not there with the Bovista. Object falls from the powerless hands. The weakness in the extremities is so marked because of which it is falling down. Menses. See the female genital complaints. These complaints are very important. One must understand. Menses flow only at night, not in daytime, like Mackar. Very, very, very important feature of Bovista and Mackar. Only menses only during night time. Few remedies it is not mentioned over there, but I will suggest that creosote, sabina, sepia are also having that symptom that flow only at night. But more marked in remedies are Bovista and Mackar. Only during the daytime, seizures lying down, cactus, causticum, then it's Cilicia, then there is Squilla, the Lilium tea. These are the remedies where exactly opposite modality is there. The flow is more during daytime and it ceases completely whenever the patient lies down. Very typical of the Bovista. Those remedies which mentioned in the bracket, my suggestion is that always make a habit of opening the chapter. Just see, compare what is the difference. If you make this habit, then it become remembers in your mind, then you never forget about them. Diarrhea is there, diarrhea before and during menses. So see, every time diarrhea is there, every time before and during menses, ammonium carb is very good remedy. Veratrum album is also very good remedy. One should not forget. But in veratrum, there is a cold sweating happens to be there on forehead. It is very typical. Ammonium carb, the carbon dominates over there, and patients they are quite healthy in ammonium carbs. Occasional show means little bit menstrual discharge. Occasional show every few days between the periods, like borax. But it is in borax, it is more of a leukorrhea in between the menses. That is with the borax. Here it is very specifically, it is a it is the show. It is a little bit mm, bloody discharge, which happens to be there in the Bovista. Every menses every 2 weeks, very early, twice in a month, every 2 weeks, dark and clotted, with painful bearing down sensation. It is very close to the sepia, it is very close to the lilium tea, it is very close to the murex. These are three remedies which where you get this bearing down sensation strongly. But Bovista is having all those other features, aggravated and lying down at night, not during daytime. Those characteristics one must think while thinking about the Bovista. So Bovista is the remedy with all those complaints together. So you can catch over there the remedies very close to it are ammonium carb, the sepia, the silicia, the squila, the lilium tea, then the cactus, then causticum, creosote, sabina, sepia. These are very close to Bovista. But Bovista, the pathology is more of a psychotic nature, and this remedy is a subacute remedy. Intolerable itching at the tip of coccyx, must scratch till the parts become raw and sore. This is again one important feature one should not forget. This is very, very marked with the Bovista. They used to scratch a lot over coccyx area, and the part becomes rough. So this is in short regarding the Bovista, what he has explained. The action 7 to 14 days you can add over there in the book. Then we'll see the relationship. Compare this remedy with the ammonium carb, belladonna, the calcarea, the maxal, the sepia in menstrual irregularities. Bovista antidotes the effects of local application of tar, suffocation from the gas. That is very important remedy. One must think. It has been not given in this book, but you must add that it antidotes camphora. Bovista is antidoted by camphora, not it. It is antidoted by camphora. The inimical remedy with the Bovista is coffea. Coffea should not be used before or after the Bovista. This is very, very, very specific thing one must recollect in the mind. And last sentence, which is of a practical value. When rust seems indicated but fails to cure in chronic urticaria, think of Bovista. And this is practical value. There is one feature which is not mentioned by Allen. Urticaria aggravated after bathing is the characteristic of this remedy. So must add that in your book that this is the Bovista is the remedy where urticaria is aggravated after the bathing. So this is the remedy one should not forget, specifically the skin complaints, then the female complaints. It is a very important remedy with associated weakness in upper extremities as well as lower extremities, and the onion-like smell of the sweating in axilla. So that's all regarding the Bovista. We will meet in the on the Monday with next remedy. Uh, till that period, my suggestion that go through whatever the remedies we have discussed once again, so that it becomes fixed in your mind. Second thing, Go through the Bovista from Borix Remedica as well as the Murphy's book so that you can learn about more about this remedy over there. So that's all for today. Uh, if any query is there, definitely we'll have a discussion. Any question? Okay. So we'll meet on Monday with the next remedy. Till that period, thank you being there. Good night.